The reality is with this OPS, and full disclosure, I am on Turning Point's board of directors. As a concerned citizen and a business owner, I joined the board of directors. What I can tell you is that this supervised consumption site, since it's opened up, Red Deer has gone from being the highest death rate per capita for overdoses to the lowest death rate per capita overdoses. That happened in 1 quarter. That was the opening of a temporary overdose prevention site. That's the only difference. So moving forward, the fact that this saves lives needs to be part of the conversation. As far as solutions go, at the beginning of this year, there was a safety summit here in town. The City of Red Deer systems leadership team hosted it. But my question to the panel again today is the same question I asked you guys last night. You've been in Red Deer for another day. How have you guys been in touch with or heard of or had anything to do with a systems leadership team with the City of Red Deer? Have you heard of it? Okay. This is one of the big disconnects here, people. The city is tasked an organization, the systems leadership team. Is there anybody in this room that is a part of the systems leadership team? Hold your hand up. No. Okay, so we have one person in here that's from the systems leadership team. I'd like to introduce you to the panel. You people need to start talking. There's a big breakdown in communication between the people in the city and the city itself, and there's a breakdown in communication between the municipal governments and the provincial governments, and that's something that I think needs to change if we're going to get anywhere with this situation. Thanks.
Hi, my name is Deborah Watson. I'm a member of Mom Stop the Harm, a coalition of Canadian families. I think there's over 1,000 Canadian families that belong, who've either lost a loved one to addiction or still have a loved one struggling with substance use. I stand here in honor of the lives of over 11,577 Canadians who have died because of a poison drug supply. This panel has access to many reports containing the effect of these sites in this province. Specifically, I refer to the Alberta Community-Based Report on Alberta's Supervised Consumption Service Effectiveness. I will propose solutions to the crisis, as I would see that as the overarching goal of this review. As like all harm reduction advocates, we believe in evidence-based solutions. As garnered from chief medical health officers across this country, the current drug policies are not only creating much of the harm, they are also a catastrophic failure. Drug policies are making things worse. Solution number 1, we need to end drug prohibition. The drug policies are as toxic as the drug supply. Read Chasing the Scream. New policies with a shift to public health approach instead of a political approach need to be developed quickly. Solution number 2, we need to deliver a safe supply as the toxicity will continue to drive the number of corpses even higher. Solution number 3, we need to remove the barriers to harm reduction services, not take away what few life-saving supports we have. Solution number 4, we need to connect people with life-saving health services and supports such as safe care, ancestral healing practices, safe housing, and income assistance. Finally, solution number 5, we need to decriminalize possession for personal use. In closing, I would like to share these words from Tommy Douglas, a pioneer and founder of our Medicare. We are all in this world together, and the only test of our character that matters is how we look after the least fortunate among us. How we look after each other, not how we look after ourselves. That's all that really matters. Thank you.
I just want to remind everyone, and for those of you that came in late, our role is a neutral body. We are on a fact-finding mission. That is our role. We are not a decision-making body. So please, when you're articulating your messages up here, ensure that the facts that you want to go back to government is what you're articulating here. It's very important for us. We'll relay that information. It will be up to the government to make a decision about what to do. Thanks.
We may not be expressing ourselves the way you want us to, but it's because the city is angry. We have worked hard to make this an inviting city, and all this has done is drive people away. We have people coming from all over. Right next door, we also have a bike chop shop. selling methamphetamine. There's a drive-by pharmacy out in front of our house, okay? They've threatened us. People don't want to come down there. We also live in Riverside Meadows, which is starting to be called Riverside Ghettos. We have worked very hard in that community to make it safe and friendly. You talk about economy, what business is going to want to move to Red Deer? People are moving out already. They don't want to be here. We're tired of this. Safe injection site is not the answer. We need rehab jail and follow-up. We don't need no safe injection site. Why are they allowed to keep thieving, to walk the streets with an illegal drug? If I were to walk downtown with a joint of marijuana, which is legal, would I not be thrown in jail? Would I not have to face consequences? These people are not facing consequences. Our justice system needs to be changed. The RCMP needs more power to stop these people. They can't stop them on their bikes with those carts behind them. We have watched them make weapons and conceal themselves, full masks, to go out and commit these crimes. We're not safe in our own yards. We're tired of this. Something has to be done because it's ruining our city. That's all I have.
Can we just hold on for 1 second? Can you elaborate on one thing you said about the drive-by pharmacy? Can you tell me about that, please, briefly?
All hours of the night and day, this house is operating. In the alley, there was a couple living in a motorhome in the alley, which is against our bylaws, right? The bylaw officer comes and asks. They say they're just getting ready to go camping. The damn thing hasn't moved. They were selling drugs from there. Out in front of our house, a woman is selling drugs. People walk along with the boat or come by in a vehicle. She goes and meets them, hands them a little package, and the money goes in her bosom. And we've reported it over and over again. Since May, it's being reported by multiple members of our community. There are mattresses on our fence so that we can't see the illegal things that they're doing. There's garbage all over their yard. Bicycles taken apart, all the things that they're thieving. And nothing can be done. The RCMP hands are tied. Why are they not given, why can they not uphold some bylaws also? We're told they don't uphold bylaws. Well.
So did that answer your question, Carrie, in terms of what the...
Thank you.
Thank you so much for your feedback.
Okay. My name is Corinne Lambert, and I really appreciate this panel taking the time to hear the community talk about supervised consumption services. I'm going to actually follow what you asked us to talk about and talk about how I feel it can positively impact our community. For me, I understand people's frustrations with crime, but as a taxpayer, I don't need to see my jails filled with health problems. It does not make sense to jail people for being sick. Addictions need a completely separate stream from a socioeconomic standpoint. It does not help. You cannot punish people into health. The other large impact that I would like to discuss is grief, because we really do not talk enough in this community about the impact of grief. It's largely ignored in this debate. People who use drugs are largely spoken of as disposable, something less than human, less than other community members. People ignore that they are people the same as everyone else. They have family members, they have friends, they have colleagues, and we have service providers sitting in this room who day in and day out try and help, who provide services, mental health services, health services. Every single time someone dies in our community, that has a trauma effect on all of the people connected to them. It has mental health impacts, it has physical impacts, it has impacts to their jobs, on top of all of the emergency response services. it impacts our community on a socioeconomic level every time we lose someone, and keeping people alive will always be best practice. My apologies, sorry. As far as what future ideas I would love to see your panel consider, I'm not a harm reduction expert, but there are a ton of them in this room, and I would really appreciate if our responses as a community would be informed by the experts on the topic instead of on reactionary, upset people conflating health issues with crime issues. Thank you.
Just a quick thing. My name is Michael Mulholland. I appreciate the opportunity to talk. Firstly, I regard myself as a servant to everybody that's in this room, including yourselves on the panel, and want to help as much as I can. My background is I'm a family physician. As you can hear, I'm not from around these parts, but I've been in central Alberta for close to 20 years, and I brought my family here, and I'm still here because I believe it is still a good place to raise a family. I practiced in medicine for 30 years, and really where I'm speaking from is about 2 or 3 years ago I was asked to be part of developing a medically supported detox at the Safe Harbour Society, which is a non-profit in town that has been working with this community for a very long time, and I think has a great respect in the community as a whole. And the reason that I got involved with that was working in the hospital. I was seeing the result of opioid addiction, and I've been involved with regards to town hall meetings or public meetings at the City of Red Deer, and I think the conversations and the speaking that you're having is the same problems in the two council meetings about having a supervised consumption. We were sitting with 47 deaths per 100,000 population. That was double the rate in Alberta. That was almost 15 or 16 higher than Lethbridge, which was the next highest to us. So this was the epicenter of the opioid crisis. We've now had the supervised consumption, and I'm a family doctor. I want to serve in whatever way I can the people that are in this room. Really, I want to serve in whatever decisions that you guys make, and whatever the government decides. I'll work as hard as I can to help this population and to help you guys, because they're all part of us. It's not them and us. I come from the north of Ireland, and I can tell you that if we do them and us, it goes on for a hell of a long time. This is us. This is us, right? These people that I serve at the detox are your mothers, fathers, sisters, brothers.
Yes.
They are people, they're our community. They're not choosing this. I can see some of the results at the hospital of what happens when people use. This isn't something that they've chosen, and if you think you can actually punish them into recovery, I wish that was easy. I wish we didn't have this problem. I actually wish that closing, and we don't have a supervised consumption, by the way. We have a OPS, which is no wraparound services, just use the drugs. There's no counselling in terms of apart from what the Turning Point staff do, and I can tell you they work tirelessly 24 hours a day to try to connect with these people, because Johan Harry, who's an expert in addiction, if you actually want to think about what this is all about, the opposite of addiction is not sobriety, the opposite of addiction is connection, and that's why I think that what we need to do is try to connect with these people and get them gone. But the one thing I'd like to say is the problems that people are voicing today were here prior to the OPS. They'll be here after you decide. If you decide not to have one, it's still going to be here. The underlying problems, I'd love them to go away if you closed it down. I would love it. As a doctor, I would love the problems to be gone. But we need to deal with the deep-seated problems. And I think the one thing, and I would say in 30 years of being a family physician, I cannot help someone who is dead 100% of the time. Thank you.
Reopen it.
Hi, my name is Joe. I'm here to represent Canadian Tire. I'm a loss prevention officer, and I'm tasked with the protection of $22 million of inventory. My background, I was in the Canadian Armed Forces for 25 years. Since this injection site, I'm going to say Safe Harbor, Mustard Seed, and Turning Point. All they are doing is sustaining the drug user. They are not helping them. I've had knives pulled on me, I've had guns pulled on me, I've had needles pulled on me. would everybody in this room